This is Kevin McDonald coming to you from the 2010 ASC show. I'm here with Joe Zaza from Dallas, Texas, correct?
Yes, sir.
And Joe's been a client for quite some time. Tell us a little bit about your facilities and your organization.
Well, we were founded in 1986 as Ambulatory Systems Development, and our current company is Ambulatory Systems Development and Management, so we call it ASD Management. And we're a privately held, privately funded company, and we operate 26 outpatient surgery centers throughout the United States.
Good. And I know right now, Joe, y'all don't have EHR in any of your facilities. Is that something y'all are looking at right now? Are you considering EHR for those facilities?
Well, we're considering it, and we're trying to find the right system and the most cost-effective alternative for that. And, obviously we think things are moving in that direction, but we've been a little slow to make a final decision on it because, we're just trying to find the right system for our company.
I'm Nancy Daniels in Plains, Pennsylvania.
Wonderful. And your facility is?
It's a pain management single specialty. We're freestanding from the hospital, and we have 2 ORs, and we're a Class B facility. We are actively looking. It is in our future plans to put EMRs into effect. I think it's important for all the facilities to have that medical records that you could go across the board and get any information on any patient. I think that's the way the future's going, and we need to all get on board with that.
I'm Lisa Everson from Laser and Surgery Center in Lacey, Washington. Presently, we do not have an EHR system. We are looking for one. We're trying to find one that's actually going to work well for my staff. Also one that's going to be possibly compatible with the clinic, because the clinic is next door with us. And also one that is going to be whatever is going to work well with the government that's deciding what they're going to be having coming out, so we're in compliance.
Roxanne Degnan, and I'm from the Riverview Ambulatory Surgical Center in Kingston, Pennsylvania, multi-specialty. With the Medicare reimbursement coming up and the changes that all facilities are required to go towards electronic medical records, we're really actively looking at it right now. And I guess the biggest thing is to help the patients with continuity of care, like to share records between hospitals, other surgery centers.
We've got 17,000 patients a year. We do 16 specialties, lots of GI, lots of eyes, lots of ortho.
What do you hope to accomplish putting EHR into your facility, Jim?
Well, EHR will help us reduce claims volume, transcription. It will help with the physician's order entry. It will help us with safety. There's a million things that it will help us with, but more than anything else, I was designed to be a surgery center, not a record storage area. So getting those records on electronic media will help me take 10,000 square feet of surgery center and turn it back into surgery center instead of a records vault.
Do you have certain criteria yet, or have y'all even gotten that far as to determining what criteria you'll use to select an EHR?
Well, the criteria is going to be, A, is it user-friendly? B, does it sync in with our source system? And then the cost.
Great. Now, as you look for an EHR, will you look for something that that integrates with your billing system? How will you go about that process? How will you go about looking for that?
I don't think you have a choice. I think you really have to have something that integrates with your billing system, especially when you're looking at, if you're looking at op notes and things like that, and you have to make sure that exchanges with the codes and they match up. So, and you want to send that forward because you want your AR to be down. You don't want your AR, you want that to be under 30 days best you could. If you could send that out immediately, that really helps that process.
I'm Sue Ford from San Joaquin Laser and Surgery Center in Stockton, California. Make sure that we don't miss opportunities for correct coding, that we're maximizing our reimbursement, that it's a smooth transition from the record to billing and so on. And the fact that you would be able to maybe verify the insurances ahead of time easily through the system and incorporate all that to a smooth billing process.
You have to have something that works for the whole facility. You can't have something different for billing than you would for your medical records. It all has to be continuity, like the whole entire process, because there where your cost containment would be down, and even just with the billing, like Roxanne said, in 30 days rather than 45 or 60-day limit on that. You really need to keep the money coming in.
What kind of time frames do you have for trying to get one in at this point?
We're probably looking to try to do within the next 12 months, and they're trying to get something that we'll look at that's going to be good. Maybe have some come in to do some demos in the office webinar with them to try. And I want to make sure that staff's on board because I think that's the biggest thing. If I don't have staff behind me, it's not going to work.
My name is Debbie Clark and I'm from the Kamloops Surgical Center in Kamloops, British Columbia, Canada.
I understand from just speaking with you that you've implemented or are in the process of implementing an EHR in your facility. Can you tell us why you did it? What are you hoping to accomplish with your EHR in your facility?
Well, number one is that real estate's a very expensive item, and to have to offload our records onto an offsite and pay for storage was very expensive. So EHR really helps with downloading that cost.
Do you feel like in your facility, do you feel like you have the culture and the people that you're going to be able to take advantage of an EHR, or do you feel like you're going to have some resistance?
I feel like it's going to be uncomfortable to begin with because it's something new. Anytime you introduce something new, the staff tend to resist. Once they discover the benefits and the ease of use, they'll be right on board.
So one of the challenges we have is bringing an operating system and a marriage with the electronic health records. And so we kind of came to the epiphany this week that great has been the enemy of good at our facility. So we're just going to move forward and make it happen.
We are a freestanding ambulatory surgery center. We're doing about 4,000 cases a year, multi-specialty, 2 operating rooms, 1 swing room, and a procedure room.
Can you tell us a little bit about the selection process? What things did you go through? What did you look for when you looked for an EHR in your facility?
We took into account what the skills and abilities were of our management team, and myself and our business office manager had a lot of experience with Advantix. So we decided to take a look and see what gave us the most advantage if we were going to use Advantix, what EHR gave us the most advantages. So we went through that process to see which would give us the most capability and be the hardiest EHR for us to use, and it turns out that the Source Plus product was that one.
Well, it definitely saves time with our staff looking for medical records. They can just pull them up online and they're attached right to our patient. We don't lose records anymore, and we can find them quickly. If a doctor needs a certain operative report mailed out to them, it's just a click of a button and off it goes.
Our super users got some extra training, and they got some extra time with the trainer to work on some troubleshooting, common problems, common things that you might run into that you need to fix. And we use those super users not only to train our new employees, but also to be the resource for our physicians and for our staff on a day-to-day basis.
The physicians and the staff really love the EHR program. It's basically pen and paper in a computer, and that's what they like about it, ease of use, and it's as easy as you can make the program, or as easy as you can develop the forms. That's how easy it gets.
Do you feel like there's a return on investment for you as well? Do you feel like you're actually saving money by having an EHR in the facility?
Absolutely. Implementing is tough. It takes a lot of time. It takes a lot of training. You have to put the money and the time into getting it up and running. But in the long run, it's definitely going to be a time and a cost saver.
When we look at the savings, our biggest savings we've seen has been in FTEs. Those people that are assembling the charts, storing the charts, filing all the charts. The ongoing inventory, those kind of things that someone used to sit at a computer and do that we do in real time now. And so our biggest savings has probably been in the FTEs, and those have been the ones that are the most noticeable. Of course, we notice the amount of room and the storage fees and the amount of trees that we're saving and all of that stuff, but the real hard savings has been in FTEs.
If I told you today, Scott, that I was going to take that product back from you and you had to go to paper, what would your response be?
I don't think our staff would allow it. We would have to find something to replace it because it's truly, and I don't know of another product out there that will replace it.
I think once you go to a successful electronic health record, you'll never go back. I can't believe how much time and effort and money we spent shuffling papers around.